Hello, pharmacology students, Dr. Bratt, and welcome to A Chat with Bratt. The purpose of this presentation is to give you some heads up on how to really learn to remember drugs. I've been teaching pharmacology for a few years now, and I know that students really struggle with the amount of information that is required to be successful in pharmacology. So I'm going to give you some good tips to help you to learn drugs, remember drugs, and be able to recall that information when you get to your exams. So let's get started. So basically, when we study drugs, it's basically all the same things. What you need to know is the action of the drug, which means how it works in the body. You need to know why that patient is getting the drug. You need to know what the side effects are. You need to know what the contraindications are. And you need to be able to apply that within the context of the nursing process because we are using that information to take care of patients and to be safe in our practices. So the first thing you need to think about when we're looking at trying to remember drug is that we have to think about that patient. So many of us are visual learners. And so that means that when you're studying drugs, it really helps to think about that patient and think about what that patient looks like, what's wrong with that patient, and really develop a mental image about that patient. Now, it might be you might conjure up an image about a parent, a grandfather, a colleague, someone you've taken care of in a healthcare setting. But I want you, first of all, when you see a drug, see if you can visualize a patient that has the problem that drug is trying to address. It'll really help you then to cement that information in relationship to a real person. So here's my patient. This is Mr. Meyer, and Mr. Meyer is 78 years old. He has a past medical history of rheumatic heart disease. He's had a past myocardial infarction. He suffers from intermittent angina. He basically is dealing with right now congestive heart failure, and he's going to be taking the drug furosemide to address his congestive heart failure. And if you think about what you've learned in patho, what congestive heart failure looks like. And with congestive heart failure, you're going to see such things as shortness of breath. You're going to see some lower leg edema. You're going to see some weight gain, again, swelling in the extremities, might see elevated blood pressure. But as I think about this drug furosemide that we're going to be giving to Mr. Meyer, I keep that in mind of what he looks like right now. If you see him in this picture, he basically, it's hard to tell, but his color is a little pasty. It might even be a little cyanotic because he's having trouble breathing. He's got oxygen on. So he's got lots of things going on, but we're going to give him a drug that will help to deal with some of these symptoms. So we're going to talk about furosemide. So when I think about this, what I'm thinking about is basically what is going on with this patient. And I have to know what this patient looks like because before I give a patient a drug, particularly if it's the first time, I have to do an assessment. I have to know how my client is right now. So what does Mr. Meyer look like right now? And we just talked about that. He's got some shortness of breath. He's got some swelling in his extremities. He's having a little bit of trouble breathing. Excuse me. And that's what he looks like now. So that's our baseline assessment, and that's important because in order for us to really know whether the drug is working, we want to see improvement in that baseline assessment. The second thing you have to think about is why is this patient getting the drug? So why are we bothering to give this drug? And there's other things we have to think about of when we're looking at that patient is there something special about lifespan? This patient looks elderly. Is this patient pregnant? Is this a child? We have to put that into context because those factors may change the way that drugs are metabolized and excreted. You also want to think about some of these things that might be contraindications, and such things might be other underlying health problems or it might be other drugs. So before we even think about the drug, think about that patient and then think about what's going to impact that drug therapy. So as you open up your textbook, you go to the section that talks about furosemide. And furosemide is going to be, of course, included in with cardiovascular drugs, but you'll go to your book, and what you want to do is start pulling information from the book, and you want to be thinking about the action. So look and see what the action of the drug is, and pull that information out of your textbook. Then what you want to do is think about it. Okay, this is what this drug is doing. Now, how is this going to help my patient? So you have to put that action within the context of the particular patient that you're taking care of, because a drug has many different uses, but we have to basically match the use of that drug to that particular patient situation. Then you have to think about, okay, a drug has all kinds of things we want it to do, but as you're learning, is that drugs do things that we don't necessarily want them to be doing. And these are side effects, adverse effects. These are things that we don't necessarily want to happen, but they come along with the drug and we just can't help it. So we have to think about those, again, in relationship to a patient. So if this particular patient is going to have problems with a particular side effect, then you really have to think about that. And we have to think then further along how that's going to impact our nursing care. So after we know what the drug does and we know what the action is, then we have to think about, what do I need to monitor? What do I need to pay attention to? What is it that I need to keep watching my client for? And this is going to be dependent upon what that drug is supposed to be doing and whether it's doing the job that we want it to be doing. And again, that's why it's important to have that baseline assessment and to, again, picture that client. So I saw him when he came in and he was short of breath and he's had all this additional fluid on board. And so am I going to see changes in that? And hopefully when I give furosemide, that's going to happen. So then you have to think, what else do you have to monitor? Well, I'm not only going to watch to see whether it's getting better and whether, again, he's having a more less difficulty breathing, whether he can sleep lying down, he doesn't need 4 or 5 pillows, that he basically has better ability to do activities of daily living. I also have to watch for these side effects. So I have to think about the drug and what type of side effects do I need to be careful about and to monitor the client for. So the next part, you have to think about, what are the priorities? You're going to get test questions that always ask you about priorities. So when you think about priorities, you have to think about, what do I have to do first, second, and third? And when you think about those priorities of care, you always have to think about, of all these side effects, which one I have to be certain that I monitor. So for this client, you're going to be thinking about things like, okay, is this helping him to breathe better? And is he suffering for any type of side effects that could be life-threatening, which could be, if you know anything about furosemide, it can cause potassium imbalances. So I need to make certain that that is a priority. So that's really important to be thinking about. So here's a little bit more information about priorities of care. So I said a minute ago, you have to think about airway, breathing, circulation. Is this drug having any impact on airway, breathing, circulation? And we hope it's having an impact in positive ways. But many times drugs, as you know, come with adverse effects. So is a patient having adverse effects that I have to be very aware of and to be monitoring the patients for? So you learned about some of these things in your prior modules, and you're really learned about toxicities and such things as a priority of care is going to be if a drug has toxicity to the bone marrow and having problems with white blood red cells or platelets. It's going to be a problem with kidney or liver problems because it might create problems with drug metabolism and excretion. Some of the drugs you're going to be learning about cause a problem called malignant hyperthermia, which causes the body temperature to rise very dramatically, and that can be life-threatening. And some drugs can also cause problems with altered glucose, which can be life-threatening as well. So think about those things that need to be assessed because they can present a problem to that patient's well-being. So what do you need to teach the patient? So what you need to teach the patient is, first of all, how to take the drug and how to take it safely. And so that sometimes means that certain drugs work better in the evening, some work better in the morning. So you need to think about it. So if we're talking about Mr. Meyer, if he's taking furosemide, what time of day do you think would be best for him to take it? Well, I hope you said that it would be best to take it in the morning so that he's not up all night urinating. So those are some things to be thinking about. You also need to know when to contact the provider, and that's when the patient is having side effects are adverse effects or overzealous responses to the drug that need attention. So those are things that you need to star and really tuck away in your brain, because those are going to be the answers to your priority questions on your exams. You also want to think about, what other ways can we help this drug work? So are these things like certain types of lifestyle changes? Are these things that we need to teach the patient to avoid in the diet? And those are all important things to be thinking about, because we have to empower the patient to use additional strategies to help the drug to work, and also to be taking the drug in the way that's going to be most beneficial. So the question becomes, what do you do with this information? Again, you're pulling all this information out of the textbook, and you're trying to understand these basic elements of the drug. And it's important because it's going to help you to be successful on your exams. So what I'm encouraging you to do is basically to make your own medication drug card. And so this is just a template that you can use to do that. So what this template includes is, at the top of it, you include the drug name and the category. So that might be furosemide, and it goes in the category of diuretics. And it's good to identify what are your priority assessments. So then you take a look at, pull out of your textbook, what is a drug action? And what's that drug action that is identified in the textbook? Now, it doesn't have to be long. It just has to be basic information so that you have some idea how the drug is working, so you can assess for the effectiveness of the drug, and you can be monitoring patients for these adverse effects that can also come from drug action. Then you take a look at, pull out your textbook, what are the adverse effects that are listed along with that drug? And then pay attention to them and write them down in the list. And then you move forward and you look at contraindications and interactions. And the same thing, you pull those out of the textbook, and you don't have to list every interaction, but you have to list the major ones. And lastly, you have to talk about, or pull out of your textbook, the nursing care, which looks at assessment and diagnosis and planning and implementation. And this many times comes out of the section where it presents a case study in your textbook. So pull those things out. So this is a strategy that I'd like you to start thinking about and to create your own med cards. And in your second presentation, you need to look at or watch that to see how I have applied that knowledge that you are extracting from your textbook and putting into perspective in this table, and what you're going to do with that information. So happy learning. I hope this is helping, and stay tuned to part 2. Bye-bye.